5 years after the COVID-19 pandemic first hit the United States, scientists are still trying to understand the impact the virus had on our bodies. And now West Michigan scientists are finding some answers about why some so-called long COVID sufferers deal with brain fog and other cognitive issues years after infection. I spoke with those scientists to find out.
So it's super fascinating.
A new study found two biomarkers in long COVID sufferers that could explain why they feel so foggy-headed years after infection.
It has a tremendous impact on, not just well-being, but also on society overall. And
That's Dr. Michael Lawrence, a neuropsychologist at Corewell Health, and Dr. Bengt Arnetz, a professor at Michigan State College of Human Medicine. They found these two biomarkers, which could explain why these patients report a lower ability to adapt to stress and higher inflammation in their brains.
What we often hear these patients describe is, I can still do things,
yeah,
but it's harder and it takes longer and nothing's automatic anymore.
Dr. Lawrence described it as an enormous feeling of fatigue.
something in the brain that indicates the brain isn't as neuroplastic as it used to be.
Still, much about the long effects of COVID-19 on our bodies are unknown.
And we know that inflammation is not good for the brain over time. You have more neuronal pruning, and the concerning question is are you going to be at increased risk for developing dementia as we age?
With current testing, many long COVID strugglers tend to look normal, but patients say they feel frustrated because they're still feeling the cognitive symptoms.
You don't imagine these things. These are real things, and now we can measure it.
Studies like these help find answers for these patients.
But if this is clinically validated over time, then we could help identify perhaps who may struggle and who may recover quickly so that we can wrap around support and treatment early.
Now, the doctors say the study's findings are preliminary and additional studies and more research is needed to fully understand the effects of long COVID on our brains. But that's something at least these doctors want to continue to pursue.